Hello, I'm Glenn Poole, CEO of the Australian Men's Health Forum. This is Men's Health Connected, day 4, where we've been talking about nursing for men's health. In this final session of what's been a fantastic day, we have a panel who are going to discuss the question, are male nurses good for men's health and gender equity? Joining me to explore this interesting topic are Professor Tony McGillion, Mark Aitken, Luke Yokota, and David Heath. And we're going to start with a really easy question, which is essentially, who are you and what's your role in terms of men and nursing? Take a couple of minutes each to introduce yourselves so we can all get a flavour of who we're going to be in the company of for the next hour or so. And I think I will come first to Professor Tony McGillion, who is Professor of Nursing and Director of Partnerships at the Trobe University. Tony, thanks for being here. Tell us a little bit about your background and why you're in a conversation about male nurses.
Fantastic. Thanks, Glenn, and thanks for the opportunity to talk with everyone today. It's fantastic to see so many people. Look, I know it doesn't look like I'm old enough, but I've actually been a nurse for about 38 years. You were probably thinking sort of 15 to 20, I'm sure. However, I was not just a nurse, but as many people have called me in the past because they've combined male and nurse and called me Nurse. So I've been a nurse for many years as well. And I trained in the UK in the very early 80s when being a student nurse, regardless of gender, was a pretty gritty type of experience, I have to say, but good fun all the same. Currently we've got a 9.7% male nurse ratio to female in Victoria, but in the days of my student training in the UK, I was the only guy, perhaps in a group of about 45 females. And as a male nurse at my training hospital, I was definitely in a significant minority. But at the time, I didn't really think about it that way. I just had so many new things to learn, so many new friends to make, and I was having so much fun in the process that I didn't really reflect and stop to think on what it really meant to be a male nurse in those days. What I did potentially feel on reflection was I felt like I was in a minority group, which of course I was, a very small minority group. And maybe I perceived by being in a very, very small minority that the spotlight perhaps was on me as a male in nursing to perform in a different way to the majority. And definitely the spotlight, I assumed I had to perform better to be accepted as a male, which may not have been how anyone else felt, but that's on reflection, that's how I felt at the time. Whether I succeeded in being any better or not remains to be questioned and remains to be seen, I suppose. But it does remind me of a fantastic book called The First 90 Days by Stephen Watkins. I don't know if anyone's read that. But I felt like I was in my first 90 days for about the first 10 years of my nursing career, where I felt like everything I did or didn't do was potentially amplified because of my gender. And again, this is my own personal experience rather than having any evidence that anyone else felt the same way. A couple of years ago, I was invited to write a piece for the College of Nursing. I think it was the Hive, actually, no, it was the Men in Nursing publication that Luke was facilitating at the time. And I wrote a very tongue-in-cheek article called If Florence Were Frankie. So I tried to hypothesize what potentially could have happened if Florence Nightingale had been, excuse me, had been called Frankie Nightingale, and the first nurse was a male instead of many preceding. Just excuse me, I haven't coughed for about 35 years, but now because I'm on camera, I can't stop. And I actually, again, tongue-in-cheek, talked about, instead of the lady with the lamp, it was the chap with the lamp. And it was a very humorous, I thought anyway, sort of account of being a male nurse in a female-dominated profession over many years, which has been fantastic fun, I have to say. And probably the final point I'd like to make, so I'm not taking everyone else's time, is that for the first 3 years of my career, I was only allowed to look after male patients. In those days in the UK, male patients were not allowed to touch female patients, which is, it sounds very old-fashioned now, doesn't it? So I spent a lot of time with guys hearing about their men's health issues and developed a very good empathetic ear to them and a fantastic understanding of what it's like to be a male who is in need of care, whether it be acute, subacute, or rehab, or whatever. And I'm sure that's really given me a significant interest in men's health in general. So we should never discount the effects our very early days of our career make on the rest of the time. I might leave it there so that the others get a chance.
Great. Thanks, Tony, for that great way of starting it, taking us back. I've said this a few times today, taking us back to the last century, starting in the 1980s. Who remembers the 1980s? Wow, those were the days. Dealey Boppers and Margaret Thatcher. That's it. So certainly remembers the last century as he started work as a registered nurse over 30 years ago. This is Mark Aitken, who's the Deputy Director of the Nursing and Midwifery Health Programme in Victoria and the Stakeholder Engagement Manager with Nurse and Midwife Support. As well as being a male nurse, Mark is passionate about ensuring all nurses, midwives and students have support for any issue whenever they need it. Over to you, Mark. Tell us a little bit about your experience of being a man in nursing.
Oh, thanks very much, Glenn, and hello, everybody. Anthony, you stole my thunder. I had that line down too, that you probably might not believe it, but I've been a nurse for 37 years this year. And like you, Anthony, I started nursing in the 80s. It was in fact 1984. And I've loved my entire nursing career and been privileged to work with incredible and exceptional nurses and midwives throughout that time. I was one of one man in my group of 75 young women. I was 21 and most of them were 18. We all lived together in the Royal Melbourne Hospital nurses' home, and you can imagine the parties and the fun that went on. So I don't know if I've reflected on this, but I've often wondered if I was fully accepted and fully embraced because I was the only man in my group. And I just became part of the group really and the pack. So I can't tell you how many parties we went to, how many weddings of nurses in my group that I went to, and how many times I was asked to be the godfather of their children. So really privileged position. I've had a really rich and interesting career. I'm currently the Stakeholder Engagement Manager with Nurse and Midwife Support, the national 24/7 support service for nurses, midwives and students. And it's a role I absolutely love and I'm incredibly passionate about. I've worked in many and varied areas of nursing midwifery, including general surgical, medical units, critical care, sexual and reproductive health, education, research, project management, maternity services, and residential community and specialty aged care services. So I guess when I reel those off, you understand that I have been nursing for 37 years, because that's kind of a big career in a big life. I've held senior leadership positions within the aged care and healthcare sectors. And in 2016, they were starting up this national support service for nurses and midwives. And they advertised a position called Stakeholder Engagement Manager. And I thought, I have no idea what that position would do, but it sounds really interesting. So I applied for that position, was lucky enough to get it. And I was part of a team that established and created this important national support service. The one constant in my career has been the great profession of nursing, which I'm incredibly passionate about, as I think I've said. And so I feel very privileged to work for a service that now supports my profession and the people that I count the most dear in my life. And I'm really passionate about nursing midwifery professions in general and all that we stand for. And I'm committed to supporting and mentoring students, early career nurses and midwives to ensure they have an exceptional start to their career. So I guess what's it like being a male nurse? Well, for me, it's been great my whole career. I feel incredibly lucky to be part of the profession and to have worked with so many intelligent, passionate, committed and caring people, mostly women, given that only 10% of men, around 10% are currently men. And I've learned an incredible amount from the people that I've worked with. So that's a potted history about my 37 years in the profession.
Wow, look at this. We are already clocking up a combined something like 75 years of experience of being a man in nursing. And we've only had half the panel. Looking at how youthful Luke is low, we might yet struggle to get to 100, but we'll go to David Heath first and see how close to 100 he can get us. David works with Bendigo Health, and David came across our radar because one of our member organizations, Cycle Well, we found out was which uses cycling groups and cycling weekends as a way of engaging men in their health, was using a really dynamic and engaging men's health nurse to deliver talks as part of their cycling weekends. And it turns out this guy is David Heath. So David, welcome. The first question has to be, how many years of nursing experience can you add to our 75 plus? And then over to you. Oh, still on mute.
Mute.
You're on.
That better?
You're on.
Excellent, thank you. So yes, I think I can get us to 100. So we've cracked a century already with just the three of us, old blokes. Unlike the other chaps, though, I came to it later in life, in my very early 30s. So previously to nursing, I was in the building trade. So I had, a couple of decades as a painter and decorator in the building industry, and then so majority of my working life in that industry was actually working with men, and then to actually then change over to a role as a male nurse, and the majority of the people that you work with were women, was enlightening, actually. People thought that I was in for a big shock, but it was actually quite refreshing and rewarding, and it remains that way to this day, actually. I've learned so much off my female colleagues. It's, I can't begin where to start, to be honest with you. They've been very supportive for me throughout. There's been the odd comment around regards that you've got that job because you're a man. Maybe, but whatever works, really, I guess. I think that doesn't get bantied around anywhere near as much as now, as it did in a couple of decades ago. Definitely, I think we're better accepted, particularly in certain roles. As you've highlighted, I'm fortunate enough to be asked to be involved in the Cycle Well concept, which has started here in Bendigo by a chap who was obviously a keen cyclist himself and had some issues throughout his life, and realised what a vessel exercise as a whole can be for our mental health, and particularly a push bike for himself. So I'm an old cyclist from, as a kid. I've always ridden a bike and raced a bike competitively over the years. I don't race any longer, but I still enjoy what the bike brings and offers. So he invited me to come along and participate in this cycle well camp, and it's just grown from strength to strength. And if I'm honest, in the beginning I thought, oh, beauty, I'm going to get paid to ride a push bike. But to be honest with you, I was floored with actually the concept and how well it was received, and how well it actually hit the mark in regards to, there was 16 of us there in the beginning, and the conversations and the discussion that took place in that format was mind-blowing, just to have men open up in front of other men that they'd only just met. And they did. Everyone just really laid their cards on the table, and there was no punches pulled, and there was no sort of typical male banter and those sorts of bravado things that can come along with a group of guys in the one venue. It was actually quite an honest and open discussion. It was mind-blowing. Actually, I was sold from the first sort of day. And as I said, I'm fortunate enough to be involved in that. The stuff that I tend to talk about on those types of camps, it's all focused around exercise and the wellness that comes with exercise, but just not physiologically, also psychologically. I'm a big believer personally in that myself. We all have stress in our lives and we deal with it differently. My thing's endorphins, and I get that from exercising. That keeps me healthy mentally. And these guys, there was men from all walks of life. There was you get people from, the highest ranking sort of CEOs in different organisations down to dairy farmers, and they're all mixing in the one group, and they're all offering one another support through peer support, and the discussions again that come out of that. I'm obviously a big advocate for this program, and it's not just the cycling well concept. It's anything that engages men and gets them to open up. I think is vital. That's become a part of my job informally. My current role is as a nurse practitioner in male, or not male, but sort of genitourinary cancers. So I do a hell of a lot with prostate cancer. So that's obviously men, but also I do some bladder and kidney cancer stuff as well. So that it crosses both genders. As a ad hoc to that, this emotional well-being has become a big part of my job now, to the point where as I'm being referred men with predominantly it's erectile dysfunction, but that involves not just the physiological but the psychological of all of us. So I spend a lot of time talking to men about that side of their health that, historically wasn't discussed. It certainly wasn't discussed when I was a younger guy, definitely not in the context that we talk about it anyway. So I don't know. I think there's been a big shift in men's health. I've certainly noticed it. And obviously we're all engaged and we're all driving it. So I think that we're pretty well on the front foot with all that side of the coin now. My sons particularly, they talk to me about things that I never spoke to my old man about. So I've personally noticed the change, and the patients that I see, we have some very open and frank discussions, which I think can only be for the better.
Right.
Really.
Thanks, David. Thanks for being here, and look forward to hearing more from you as the discussion unfolds. Thanks for getting us over the century. And now there's only one way really to introduce Luke. It has to be age before beauty, doesn't it? So Luke is a registered nurse who currently works in intensive care. He may not have as many years experience as our other three panelists, but he's certainly made a significant contribution to the conversation around men in nursing. He's currently one of the Australian College of Nursing's emerging nursing leaders, and until recently he was chairing the Men in Nursing Working Party, which is an excellent initiative. And I say until recently because I understand that's now evolving into another. He'll tell us why it was until recently. Luke, Yokota, thanks so much for being here. Over to you.
Thanks, Glenn. I appreciate it. And thank you to the men who proceeded with their introductions. I really enjoyed hearing them. So a bit about me, work in intensive care as a registered nurse. And for me, my every day is about clinical work and seeing the most amount of difference we can make to our patients. So my immediate contribution into the men in nursing men's health space has been with the Australian College of Nursing, chairing the Men in Nursing Working Party. But that had been running for 2 years now, and we had achieved pretty much all of our objectives. We had released a Men in Nursing ebook highlighting several stories behind men of all ages and all different backgrounds and why they decided to do nursing, which made great traction around the nation through ABC radio. I think there was a 7:30 report on the Men in Nursing Working Party, and multiple other news outlets took it up. So we had great traction with awareness. We've created multiple different resources, such as the Men in Nursing videos, which gave a really lifelike and excellent visual observation into male nurses and what exactly they love about their profession and their job. And moving more into schools now as well. We're just on the last leg of releasing some career counselling kits, which highlight how it's really, really easy for a young man or young boy to consider nursing, and how that these are the options that they may choose to take if they ever wish to decide to pursue a nursing career. But the reason why the Working Party has dissolved now is because it needs to evolve. It needs to open up to more than a small group of people, because a Working Party is not that large, as you would imagine. And I won't say too much because it hasn't been launched yet, but it's going to be much bigger, and it's going to have the capacity to hold a lot more members and to have the resources the Working Party has already created to actually branch that out and be used on a nationwide scale. But apart from that, I think I'll leave the rest for the general discussion, Glenn. So that's a good introduction for me.
That's great, Luke. And I've already had one comment in the chat box as well from Mal saying he's been a nurse for 41 years, so he beats the lot of you. So there we
Yeah,
go. We're getting up to 200 already. Fantastic. So lots of experience on the panel, lots of experience in the room. Really, there's only sort of two broad questions I want to explore, but I know we could speak for hours on either of them. I really want to look at men's health and then men in nursing. So I'm going to go straight to men in nursing and say, I'm going to assume that you all think it would be a good idea for us to have more men in nursing. So I just want to jump to the question, why? And Luke, you went last, but why don't you go first? You've got the men. You're part of the Men in Nursing Working Party and the new evolving project at ACN. Why is it important that we have more men in nursing?
I'm going to use a quote from myself. I said, "Why is it important to breathe?" Because to me, those sort of questions, they don't really need an answer because it's so obvious. But I may be a bit biased. But to give the real lay down, it's more or less, we live in a society which is greatly evolving so quickly. Obviously, I wasn't around in the 80s. If people were wondering, I wasn't. And in those areas, like, I just feel, even when I was a young boy growing up as a young man, it seems like social trends and key phrases and words are changing every 5 minutes. So that this, to me, highlights the diversity and the cultural sensitivity we have in our society, especially in Australia, where it's a very diverse population. Like, just reading the stats recently, over a quarter of Australians were born overseas. And with that, it brings a whole diversity, and we need a workforce which reflects the diversity of our population and our citizens. So for me, to have a working nursing workforce that is only roughly 10% male, I think to benefit our community, it would benefit to have a greater number. And I never think it's going to be cracking the whip out and making more incentives for men to be nurses. I think it's about role modeling. I think it's about highlighting the stories of Mark, Tony, and David and Mal. And I think it's not a common thing for people to stay in a career for over 35 years. And I think we need to capture that essence, because nursing is really, it's the glue of the healthcare system. And I feel like people who are even people who are wanting to change or do something every 5 years or so, they definitely will not be disappointed with nursing, I'll tell you that. And even with the change that's happening in the next 10 years with nurse practitioners, community healthcare, all these things are exploding, especially within the sphere of nursing. So I'll be happy to chat to any schoolyard boy and say, yep, listen, if you're interested in this and this and this, nursing's the way to go.
That's great, Luke. Thank you. I'm going to come to David. And David, I think you said you came fairly late in your 30s to nursing from construction. Without wishing to stereotype you as the blue collar nurse, can I ask also, why do you think it's important, or do you think it's important for male nurses to come from a diversity of backgrounds as well?
Definitely, I do. I'm happy to have a very blue collar. That's not a problem at all. I agree with Luke. Diversity is the key. But the flip side of diversifying in regards to the service that nurses bring to health is actually, as Luke said also, it's such a rewarding career. The opportunities are endless. I think all of us have actually spoken about our different career paths in different short scenarios. But like, I think of my career path, I've had a varied career already in health. As far as started off as an EN and then did my RN and then worked on an orthopaedic unit and then went to ICU and worked there for a number of years. And then I left for a while and I was a paramedic. And then I came back to nursing for this current role. So in my nursing career, I've had 4 or 5 varied careers out of it already, and it's all under the one umbrella, but each and every one of them has been rewarding, and I've only really changed gears because I like to sort of stretch my legs. So yeah, the opportunity for men and young men in nursing is endless. It's definitely a very rewarding career, and in reality, I'd be more than happy for any of my boys to do it. None of them have, but nonetheless, I've got 8 grandchildren now, so we'll wait and see if any of those pick it up. But as Luke highlighted also, the diversifying in regards to the service that we offer. We live in a multicultural society, and albeit we're all a bit hamstrung at the minute with the current situation, but I'm sure once we're allowed to travel again, we'll have lots more immigrants looking to come to this country, I think. And I think the more we can diversify with not only men in nursing, but multicultural men in nursing as well, it's got to be a plus. It really does. And again, to harp on about the rewarding, personally, I've worked with and not only with, but also nursed people from different cultures, and you learn so much. Like from a Anglo-Saxon male born in the 60s, the stuff that I've learned from my colleagues and patients is endless, really.
Right. Thanks, David, and thanks. Great to see you bringing in the cycling metaphors with changing gears and stretching your legs. I'm going to keep a count of how many you managed to get in the whole talk, as you subtly.
I get $1 each one.
That's right, subtly promoting cycle well. It's very skillfully done. Anyway, on your bike, I've got to go to another speaker now. Tony, I'm going to come to you. One of the barriers that's often cited to men getting into nursing is pay and career progression, and yet here you are, a humble nurse joining us as professor. So, how important do you think it is to have opportunities for career progression for us to get more men into the industry?
Very good point, and thanks to Luke and David for their points as well, which were fantastic. I mean, one thing to think about is that within nursing, there are multiple different pathways that one can take, whether you're male or female. I've worked in education, I've worked clinically, I've worked for government, and I used to lead the nursing and midwifery workforce team at DHS. I've worked in academia, where I am now. So I've done the hard yards of low pay on medical wards, lifting heavy patients. And as I've matured as a professional and chronologically as well, I've gone off and done further qualifications. I've got more experience, and I've earned the right to earn a better salary doing what I do now. And I don't see that as any different to any other profession where you start off inexperienced and you gain experience through your life. And eventually, if all goes well, you end up earning a bit more money than you did 25, 30 years ago. And hopefully that extra salary is more than just the inflation rises every year. So, but I don't know anyone who works as a nurse, regardless of gender, who is doing it for the money or even for the conditions. You know, becoming a nurse is sort of accept that you're going to work more hours that you're going to be paid for. And it's never been an issue for me. I don't know anyone that would continue to work in this profession if pay and conditions was a problem for them. So I think in terms of attracting more males to nursing in the future, there are so many other professions that men work in that pay less than nursing. I mean, nursing over the last sort of 3 to 5 years has caught up a fair bit through some fantastically negotiated, through industrial pathways, EBAs and agreements. And the rewards match the inputs a lot more than they used to. But I think a lot of like a stereotypical male behaviour is about being breadwinners of the family, and there may be some barriers to men from other cultures or multicultural backgrounds choosing nursing as a career because the initial few years perhaps isn't a fantastic salary, but neither would be if you just became a lawyer. The first 3 to 5 years wouldn't be fantastic. If you became a doctor, the first few years you're paying off all your study fees, your HECS fees, and then the next 15 years you're paying for your insurance. So there is no real profession where you've got instant fame and fortune, but there are many careers that would not be half as much fun as working in nursing, where you're working with people and people who actually need you the whole time, and you're working with fantastic other people, other nurses, other females. I don't want to ramble on too much about that, but I will say something controversial before we move on to Mark, and that's we need to make the most of the fact we can have gender-specific conversations about nursing, because I do fear that in 25 years' time, because of our frightening nursing shortage that's become even more frightening in the last 12 months, if we all are replaced by robots, then there is no particular gender specificity. So we lose the advantage that we have, unless we can program robots to be gender specific, which is probably a conversation for another day.
I'm so looking forward to the day when we do the session on gender-specific robot nurses. Alas, it's not today, but you raised a very important point, and yeah, thanks for your reflections on career progression. Mark, I'll come to you next, and maybe if you could lean a little bit into the well-being piece. I mean, because obviously you've got an absolute commitment to nurses' well-being, and in simple terms, nursing is a career which can be incredibly stressful, but also a career which can be incredibly rewarding because of purpose and the relational aspects and all the rest of it. Do you think males appreciate how rewarding nursing can be, and are they up to handling the stress?
Do I think males can appreciate how rewarding nursing can be? Well, I think men in nursing can appreciate that because we know it to be true. But unfortunately, men in the general community probably don't acknowledge or appreciate that because they don't know all that nursing can offer and provide. And I would argue that if they did know, then we would be overrun by men wanting to enter the profession. So that if men out there in the community, what I know now, 37 years into this wonderful and enlightening career, then I would say we'd have a rush at the door of universities for men to become part of this incredible profession. Can men handle the stress? Well, that's a big question. Can anyone handle the stress really that is served up by some of the things that nurses face in their day-to-day work? And I think that's been even more evident in the last year in relation to the impact and the complexity of COVID-19 and all that nurses and midwives are being called upon to do. And some people in Australia may think this pandemic is over, but if we look outwardly towards our international colleagues, we realise that it's far from over, and that it's very sobering to remember that well over 3,000 nurses have lost their lives to COVID-19. So I think observing that is really stressful for people. And what we're hearing at Nurse and Midwife Support and the Nursing Midwifery Health Program Victoria is that nurses and midwives are exhausted. They're fatigued, and they don't really think they've got much in the tank if we have a third wave in Australia. And there's some very complex issues that have come out of this, and one is around workforce. I think one of the speakers or several of the speakers have spoken about immigration as a strategy to recruit nurses and midwives into Australia, and that is pretty much dried up for the moment. And because we've needed to have nurses and midwives in the vaccination programs and in the COVID testing, we pulled nurses out of hospitals to do those really important jobs. So what we're hearing now is that there's a nursing shortage, and that is putting extra stress and pressure onto the nurses working in aged care and the hospital system. And I think on top of that is the spotlight being put on aged care with the Aged Care Royal Commission. And having been an aged care nurse and aged care leader for 15 years prior to the job I do now, I know how hard that work is and how challenging it is and how stressful it is. And having the spotlight put on that, where nurses can actually feel a responsibility for what is happening in that sector. When you have the Aged Care Royal Commission interim report with the title of neglect, then as a nurse, how can you not feel partially responsible for the neglect that is apparent in that sector? So I think there's some very big issues that nurses are grappling with, and many of those issues create stress. And to answer your question, I think nurses are really, really capable of dealing with that stress if they're supported. And that is key here, if they're supported. And that's what we're in the business of at Nurse and Midwife Support, is supporting nurses, midwives and students. So I think it's really important people know about the service. Anyone, no matter where they are in Australia, can contact us 24/7. There's our brochure. Never miss the opportunity for a plug. 1-800-667-877 or via the website nmsupport.org.au. The service is provided by nurses and midwives, so we understand the world that nurses and midwives live and work in. And you can contact any nurse, midwife or student can contact the service for anything they need support for. So support is available. If you're feeling stressed by, what the work we do, or an event or an incident that happens in your workplace, please contact our service if you need support.
That's great, Mark. Thank you. And I suppose to link this now through to men's health, I do hope if and when we get more men into the nursing profession, those support services around nurses will consider what men need in particular if they do. And I want to explore that idea for a moment. So, you know, is the growth of men in nursing, is that good for men's health? And then we'll tie that into the broader sort of gender equity conversation. But just sticking with the role of male nurses in improving men's health. David, I think I'm going to come to you because, you know, you've been working with specific men's health projects. You know, we talk a lot in this space about male-friendly approaches to working with men around their health. And Cycle Well is a fine example of it. It's targeted particularly at men. It uses activity to draw men in. And then, you know, often when I talk to projects like Cycle Well, someone will say, and at the heart of it, we've got a really blokey nurse who the blokes really relate to. Again, I don't want to make assumptions or stereotype you as the blue-collar nurse, but how much does you being a man make a difference in your ability to work with men, and particularly, you know, men like me, I guess, you know, men who consider you to be more like them than the average nurse that they would encounter?
Oh, it's tricky because in an ideal world, I'd like to say that being a male nurse shouldn't make any difference at all. It's around communication styles and communicating skills. But if I'm honest, I think it does make a difference because men can relate to whatever I talk about. I tend to personalise my talks that I do. They're very much off the cuff, and I let the room or the audience steer where it goes. I'm quite open and honest about the topics that we can talk about. If I don't know, I'll tell them I don't know. As someone that grew up through the technical school system and then the building trade, I'm fairly handy at banter, I guess, so I can use that where and when required. You develop a sixth sense as a nurse to be able to read the room, any room, whether that's got one patient or 4 patients in it or 50 blokes in it at a men's shed event, you know, and they're all half tanked or whatever. You develop this sixth sense where you can read your customers, I guess, is the point I'm trying to make. Sometimes you get it wrong and you need to apologise for that and recognise for that. I think being able to relate also as someone who's in their mid-50s with some lived experience and what have you, I think that helps. And you've just got to be able to communicate effectively. And the biggest tool for communicating, in my opinion, is the thing that my glasses are sitting on, your ears. You've got to be able to listen and give someone the chance to actually open up and yeah, if they want to put all their cards on the table, you need to allow them time to be able to do that. It's, you know, in an ideal world, it shouldn't make a difference, but I guess it does, if I'm honest about it, especially in the area that I'm in. Some of the conversations that I have, I guess they're easier as a male. But in saying that, I've also got some female colleagues that do a very similar role in regards to the prostate cancer follow-up, and they do a fantastic job. I think it's about your approach and actually how open you are and how you allow someone to be able to, again, put their cards on the table and have that discussion. And then the other good thing about my job currently is that you establish a relationship because, you know, oncology follow-up is for 5 years. So you actually get to know these people and they get to know you. So you get continuity of care, you get continuity of information. You're able to develop and ensure that they've got a good understanding of health literacy. That's another issue. People understanding the jargon. We can all get caught up in the jargon if need be, but you've got to be able to break it down into information that they can take away and digest, as opposed to, you know, I say to them, if you've got questions, please ask them. I don't want you getting in the car and saying to one another, geez, what was he on about? Because, you know, that hasn't worked. We've missed the point somewhere. So I'm big on time. I'm big on communicating skills and techniques that ensure that they know what you're on about. And I'm big on questions, but I'm also big on honesty. If I don't know the answer, I'll tell them I don't know the answer.
Yeah, thanks, David. We have this conversation a lot, not just in nursing, but in any area of health and social care, where we're talking about what makes a service more male friendly. And male staff or male volunteers or male peer supporters always comes up as an important part of the jigsaw, but it's never the whole picture. And and I think it's really, some people find this conversation difficult, that the moment you say it's important to have more men, or therefore are you being critical of women, and people like you will always say, I've got loads of female colleagues, and they're great at working with men. So we know that women play a huge role in supporting men around their health issues, but also that having more men in services does seem to make a difference, and it's a very common factor of what makes something male friendly, but not the only factor, without a doubt, but not the only factor. But keeping on the sort of, I'm going to come to you, Tony. Keeping on that sort of gender-specific theme, you raised the future spectre of gender-specific robots. I'm going to ask you not to go down that route. I'm going to ask you to stay with human nurses for now, if you would. But what does make a service gender specific? How important is it to have men in nursing to help us create a health system which is even better at reaching men and engaging with men?
Yeah, fantastic question, Glenn. And in a way, I sort of alluded to this a bit earlier by talking about the amplification of messages from minority groups. And I think as long as men in nursing remain in a minority, there is the potential that our messaging as role models to other men will be heard in an amplified way, because there's not as many of us giving those messages out. I can't prove that, of course, but I've just got that sense that when male nurses have something to say, people's ears prick up, because an unusual element or a small element of the workforce is saying something. Let's have a listen to what they're saying. So I think other men can benefit significantly from the role modeling that we do. But also we need to look at the environment that males as patients or residents of aged care actually exist. And a good example of this was, it's probably only about a month ago, I went to my GP surgery for just a routine appointment. But one thing I did notice was that all the magazines on the table in the waiting room were women's magazines. So it's like saying, no point in having men's magazines. Men hardly go and see their GPs. They probably don't even go until their illness is in its last stage. Why waste our time by putting stuff out for men in the waiting room? And maybe that was just a coincidence, but just in general, I've been to the dentist and the same thing has occurred. I've been to a number of places where that messaging suggests that men aren't expected to be in those situations as much as women. We know that men are less healthy than women in general. But it doesn't have to be that way. We know that men die at an early age on average, and we know that men are supposed to be strong and silent from a stereotypical perspective, particularly from a multicultural group of men as well. So we want to increase men in nursing, or even retain the ratio of men in nursing that we have now, to really focus in on the issues we're going to have with chronic disease and aging populations that we're all grappling with, but we're grappling with that in the midst of an ever decreasing number of nurses in general. So our 9.8% now, yes, it's still going to be 9.8% maybe in 3 years' time, but it's 9.8% of a lower number in total of an ever decreasing pool of nurses in general. So we know that there are men out there who are unemployed. They can't find jobs. they haven't maybe even thought about nursing as a vocation or a profession for them to go down. So we have to find ways of making them aware of the benefits to society and the benefits to them of a role that they can do for the rest of their careers, basically. So we need to change the way that we think about healthcare in general. And we also know there's many men out there, as they get older, they like to confide in other men about their health issues. David was talking about erectile dysfunction before. I mean, touch wood, that's not something that I've had an issue with, but if I did, I can be sure as hell that I would want to talk to David about it, because he's already shown himself to be approachable, inspiring, and a go-to person to talk to about that. Through just humanistic embarrassment, I may delay talking to anyone if it was a female, or even a female doctor, never mind a female nurse. So having a role model like David to go to, who's respectful and approachable as another man, that would be what I would choose to do. And I think that in itself is a gold standard reason why having more men in healthcare in general, but specifically in nursing, is a fantastic way of the future.
That's great, Tony. Thanks for those reflections. I'm going to move in more to the gender equality piece as I come to Mark and then Luke. In terms of gender equality and the evolving, changing world of gender that we live in, and I don't just mean here like representation, like it should be 50-50. I mean more broadly in terms of how men and women relate and what choices and options men and boys and girls have as they look forward to the future that they're living into. What role do you think male nurses play in advancing gender equality, Mark?
Yeah, good question, Glenn. I think there's an element here around breaking down some stereotypes and stereotypes that are applied to not only men in nursing, but to men generally in society, and who owns or who has responsibility for the caring role within society. I was really interested to hear this week in relation to the budget, where they're talking about childcare and it being part of the women's budget agenda. And a few female commentators came out and said, it's not part of the women's agenda, it's part of everyone's agenda. Everyone's responsibility, everyone in society has a responsibility to care for other people. And I think that's a really important conversation that we need to have as a society, and one that we are now fortunately having. So I think as we have these conversations, we break down these gender stereotypes, then we give young men, adolescents, or people thinking about a career in nursing, we give them permission to consider nursing as a profession, and indeed midwifery as a profession, and to seek information and to source role models and to access mentors who can support them to enter the career and indeed be supported in their career. So I think nursing has a huge role to play in this, and the work that Luke and the Men in Nursing group have been doing through the Australian College of Nursing goes a long way to breaking down some of those stereotypes and starting that conversation. And I've been, I guess, peripherally involved in that work, but incredibly interested. And kudos to you, Luke, and your group for leading the charge in this space.
Yeah, that's great reflections, Mark. Just the very idea broadly that care is a feminine realm, and so that when we see male nurses, male midwives, male workers in early education, working with young kids, dads pushing prams, all of these things actually challenge the notion that that the care is a feminine only realm, and open up opportunities for both men and for women. And Luke, coming to you, I'm sure you've got stuff to reflect on this, but I'm just thinking particularly about, you know, the next generation as our token youngster on this on this panel. I'm interested to know you know, how young boys in particular respond if you're going into schools and stuff like that. How important is it for them to see, you know, with the greatest respect, not our elder nurses, but actually young men who are just a few years ahead of them, who actually they can relate to perhaps more?
Yeah, it's a great discussion, and just leading on from Mark, where it's not about, if I be so bold, it's not about promoting to get more men into nursing. It's about tearing down the barriers, stopping men entering the profession. Because the more and more this conversation goes, is that we're going to acknowledge that people are individuals, and that each of us has a unique aspect and essence, which is mostly there is a particular area in life we do really, really well at. And the tradition is that females were only good at nursing. You know, that can't be refuted. You know, later in the 20th century, men were not allowed to do nursing. But we have to have the very clear assumption wiped out that it's just a neutral, it's just a gender-specific role, where when we actually go into the nursing profession, it's actually that, hey, what qualities do you have? Oh, you're a guy. Oh, you're a girl. Oh, whatever. You can actually be a nurse. And leading on to, I'm just recalling Mark's video contribution to the Men in Nursing Working Party. And you made a very specific point about the gender, I guess. You can't really tell gender by the mannerisms of a young girl and a young boy. And I'm actually doing my midwifery studies at the moment, and to see an older brother of the newborn that's just come into the world, or an older sister of a newborn that's come to the world, both are exactly engaged and interested to hold that newborn. So to me, there is an aspect where we actually have to go back to those roots and say, how have we conditioned a young man to think caring is not something that they can be capable of doing, and yet alone being a profession which is a livelihood? And in that area, when we discuss how do we, I guess, do that, I haven't got into schools quite yet, but I've definitely spoken to young men on the topic of being nurses, Glenn. And for them, it's purely, hey, Luke, I don't know how I'll go with doing university as a guy. I don't know how I will be perceived as being a male student nurse on the ward. Hey, Luke, I feel quite awkward, and I feel quite uncomfortable with even thinking of doing these, specific, very intimate skills, such as putting an indwelling catheter in or changing someone's pad. What's your experience of, nursing someone who is twice or three times your age, or what's your experience of nursing someone who's a similar age to you? And all the experience of close to 100 years we have on this panel is vital for people who are maybe a little bit younger in my age, to feel like they've got the confidence to enroll and study nursing.
Great answer, Luke, and thanks just so much for the work you're doing, pioneering for nursing in general, as well as men in nursing. Now I'm going to open it up to our room a little bit. We've had some great comments in the chat box from some of the men here, like Alan and Mal and Faisal, but there's also some great women in the room. So if any of the women want to contribute, we're all for gender diversity. It'd be good to hear a woman's voice in this conversation. So if any of the women present have reflections on their experiences of men in nursing and what they value about men in nursing, Fiona or Del or Helen or Melissa.
I've just unmuted. It's Melissa. How are you going?
Hey, go on, Melissa. Go on.
Good. Because I worked a lot in remote areas, and for some reason I can't figure out how to turn my camera back on, so sorry. But I've worked with lots of male nurses, and also I've got a 24-year-old son, and one of his best mates has just qualified as a nurse about a year ago. And I just think that we definitely need to break down the barriers of men in nursing, because it's so important to have gender diversity. But I also think, I remember when my son's friend, who's a very masculine kind of guy, went into nursing, and all of my son and all his mates really gave him a hard time about it. So I think we need to go back to schools and really make this a cool thing for boys to do, rather than this kind of unusual thing. And I think the way to do that is to get these young men who are into what we think of traditionally male kind of sports and things like that, talking at maybe surf clubs and football clubs about their careers in nursing. Because at the moment it seems like it's okay to be a health professional if it's a physio or a sports scientist, but it's difficult if you're a young man. So I think if we could make that, you know, maybe using social media or getting some young guys out there, you know, like, for instance, I know, you know, there's a couple of quite well-known young football players who are studying nursing, and that would be a great thing for young boys to see. So I think we really need to maybe make it a bit more public and a bit more media.
Great, thanks, Melissa. Great contribution. Anyone else in the room want to knock off their mic and jump in?
Just before you go on, Glenn, Melissa, do you mind putting those sports people who are studying nursing in the chat box? Because I would like to know who they are.
Yeah, sure. Okay.
Excellent.
I'll actually have to email you, because they come to my clinic in Freo and I can't remember their surname, so I'll have a look.
Okay.
No worries.
Great. Anyone else in the room want to jump in?
I'm happy just to say, Glenn, it's Helen here, that I actually, I did my midwifery training in the 90s in Tasmania, and actually was really fortunate to have, there's 3 male midwives, actually none in my group, but there was 2 in the group behind me and 1 in the group ahead of me. And one of them was a dairy farmer. So I just thought, and one of them was a nurse, had gone on and did midwife, but overall they were just so well received by the women, and I actually think they had sort of such a great place to, even in as a midwife. So it would be great. Unfortunately, since those days, I've hardly ever worked with another male midwife. I mean, there was a casual male midwife at where I currently work, that he was also a flight attendant and used to do mid as an adjunct to that. But no, I think they bring a lot of value to the space, and I'm sure that Fiona and probably Jackie may agree, in the midwifery space, it's very female dominated. So I think it actually just changes the dynamics somewhat to the, actually for a benefit to have some male midwives in that space. So really congratulate you, Luke, and yeah, look forward to hearing about your journey moving forward.
Great. I've got a comment. Thank you, Helen. And a comment from Jackie here. Luke speaks very well in promoting the advantages of males following a career in nursing. So important to raise awareness of the advantages and opportunities to plant the seed early. So we'll wrap up, okay? But I'll give you all one last go on the microphone, our esteemed panel. I suppose I should come up with some ridiculous question, like if you were a vegetable, what kind of vegetable would you be? I'm trying to think of some simple way of ending. It's not going to be that, and no doubt you'll all chuck in your vegetable. Your final thoughts then. Let us assume that we all agree that removing the barriers to picking up the way you worded it, Luke, we were effective at removing more of the barriers to men getting in nursing. We had a bunch of blokes here, and they wouldn't have to all be young blokes. I mean, I've got a neighbour in his late 50s who's just doing a career change and training in nursing. You can jump into nursing at any stage of life. We had a bunch of unemployed blokes and young blokes and blokes going for early retirement and wanting something to do, and blokes who are unemployed, and all of that. What what would you say to them in 1 minute in terms if they were considering a career in nursing? And I'll come to you, Mark, first, please.
Well, I would say, like the Nike ad, just do it. Because you'll have an incredible career, a fantastic life. You'll meet wonderful people and you'll make a huge difference to the life of others. Can I also add quickly, Glenn, that it's yesterday was International Nurses Day. So I'd like to remind people that it's really important to celebrate nursing as a profession. Last week, the 5th of May was International Day of the Midwife. So equally important to celebrate the wonderful profession that is midwifery, and to actually, as people in these professions doing incredible work and often very difficult work, to remember to take some time to pause, reflect, celebrate, and pat yourself on the back for a job well done. So I'd like to thank all the incredible nurses and midwives out there.
That's great, Mark. And one of those incredible nurses is Faisal, another man who's worked many decades as a nurse. And he says that the only issue with the career he had was shift work. Other than that, a beautiful career. And he also wants to thank you all for a really interesting session. So I'm going to come to David next. David Heath, you've got your 1 minute on the podium. What would you say to a bunch of blokes about becoming a nurse?
Yeah, go for it. What's been holding you back? Just do it. Is not the Nike ad, but yes, stretch your legs, put your feet in the pedals, any other sort of cycling metaphor I can get hold of, but you will not regret it. There's so much opportunity and there's so much diversity in nursing, not just from us four that have been on your panel today, but the people in the audience as well. People working remotely, midwives in Tassie. It's the world is your oyster. It really is. So yeah, just do it.
Jump in the saddle and do it. There it is. Thanks, David. Been a great contribution and fantastic to meet you at last. I've heard about you for a good long couple of years, and really great to have you with us today.
Thank you. Pleasure.
Thank you. Luke, I think, just you showing up is inspiration enough for other men, but I'll give the opportunity to use words as well. What would you say to men considering a career in nursing?
To highlight the benefits. A minute would not be long enough. And really, I would have to refer them to the resources that have been created. So to the ebook, to the videos, to all that stuff. And if you still have more questions, just know that there's someone to reach out to also discuss. So really everything that we've said so far in this discussion, and can't say much more.
That's wonderful, Luke. And yeah, actually hearing men like you and all the men featured in your videos talking about their career is probably the best recruitment tool there is, actually. Yeah, hearing other men's stories, I think it's very, very powerful. Professor Tony McGillion, I'll come to you for the final word.
And look, I know we were talking metaphorically about vegetables before, but I would dangle a carrot to these people that you're talking about, Glenn.
Beautiful.
And I would say, and I actually give them my story of what I've managed to do in it's now 38 years, because my introduction took so long, of course. I've worked dutifully employed. I've never had any risk of being unemployed in those 38 years. And not only have I worked with fantastic people, I have worked in the UK, I've worked in Saudi Arabia, I've worked in France, I've worked in Melbourne, I've taught in China, and I've taught in Singapore. So tell me what other job you could possibly do that would give you that variety of experience and enjoyment.
Wonderful. We used to say to young men, join the Navy and see the world. Now we say, join nursing and see the world. But only when the pandemic's over, obviously.
That's right.
And I'm going to give the final word to one of our audience, Alan Wentworth. He says, thanks all. This has been an inspirational day. Becoming a nurse at age 30, 21 years ago, changed my life for the better. and likely saved me from going down the wrong path in life, it was a lifesaver for me. That's just sent goosebumps down my spine. This has been a wonderful day and a fantastic panel. Thanks to all our speakers on this panel, to Mark Aitken, to Anthony McGillion, to Luke Yokota, and to David Heath, and to all the speakers today, as well as everyone who's attended, male nurses, female nurses, and everyone else besides. Thank you so much, and I hope you'll come back and join us tomorrow for day 5 of Men's Health Connected. Goodbye.